Caitlin. And medication-assisted treatment, or MAT, is the gold standard of treatment, but I just want to slightly addend that. It's the gold standard of treatment in conjunction with multimodal treatment to kind of address the entire patient and what's going on. The purpose of MAT is to kind of address any sort of acute physiologic withdrawal, dependence, in order to, make the patient as comfortable as possible to then address additional mental health, physical health, psychosocial stressors that are presenting. So that's an important key. And the point of MAT in treatment is to, keep people alive. It reduces mortality so that they can kind of pursue treatment and live fulfilling lives. That being said, I'd like to break it down into kind of like three major types of medications that are FDA approved, and I'll just briefly go over them. First, they're the full opioid agonists. I'm primarily talking about methadone. And when I say full opioid agonist, it acts like any other opioid, like, oxycodone, et cetera, except with a longer half-life to kind of address withdrawal issues. Some pros of methadone is the fact that, it is very potent in addressing acute withdrawal, addressing cravings. It's also highly regulated, and you need to be in treatment at a methadone maintenance program, which opens the door for individuals to kind of make contact with the healthcare system on a frequent basis to address other things that are going on. Some of the cons of full opioid agonists is the fact that, again, there is that risk for accidental overdose, respiratory depression, and kind of becoming dependent on that medication as well. The second class, newer class of medications, are the partial opiate agonists, primarily buprenorphine, known popularly as Suboxone, which is one formulation of it. So the difference between methadone and buprenorphine is that buprenorphine is a partial agonist. So there is somewhat of a ceiling effect, so that the opioid receptors are engaged enough to stave off withdrawal and cravings, but they aren't 100% engaged, so the risk of overdose, accidental overdose mortality is theoretically lower. And then the last class is our opioid antagonists. These are medications that effectively block the opioid receptors to kind of block the euphoria or the use of opiates. And that is primarily naltrexone. Naltrexone is available both in oral formulation and a monthly injectable, Vivitrol. Just to go back to buprenorphine, buprenorphine is also available in various formulations as well. You can take it by mouth. It's in combination with naloxone to kind of reduce the abuse potential. And it's also available in injectable form, Sublocade. And there is also an implantable, which is Probupine, which is very rarely used. But it's an implant that goes subcutaneously or on the inner arm, beneath the skin in your inner arm. And it can be used for up to 6 months. More recently, the Probupine has been pulled from the market by the pharmaceutical company that makes it for different financial reasons, but they are looking to reintroduce some sort of variation of it in the near future.